And in the meantime, I'd like to call here on Dr. Saurabhi Khanna. She's there? Yeah. You be here, ready here.
Good afternoon, everyone. It is very difficult to cover all the lid tumors in 4 minutes, but I will try to cover the majority, the common ones which we see in a daily OPD basis. So what is this? Adult patient presenting with this kind of a lesion. Okay, very well diagnosed umbilicated lesion, whitish on the lid margin. It's molluscum. Now see this, a 3-year-old male child presented with the swelling since 1 month, rapidly growing. Parents were concerned that it's getting necros and the color is changed. So what is it? We tried doing it biopsy and the biopsy suggestive of molluscum. So what is the takeaway point here? The takeaway point is lid tumors that we see in the pediatric age group are generally benign. In case of any dilemma in case diagnosis, you can go ahead with the incision or the excision biopsy, but generally they are benign tumors. What is it? A small child, 3-month-old, presenting with the lid mass and mitosis, and with the treatment, child recovered completely. What is the treatment? This is nothing but the capillary hemangioma of infancy. And how did we treat it? With oral propranolol. So it's a drug of choice nowadays, and we start with the 1 milligram per kg and can step up to 3 to 5 milligram per kg. Now similarly, a more severe lesion of capillary hemangioma. So when do you see a child like this? What is the next line of the management that you do in such cases where the child is presenting almost with the total ptosis? The next step of management in such cases is basically imaging. So whenever you see a case of capillary hemangioma with the mild amount of proptosis, the imaging is very important because that can tell you the orbit is involved or not, and accordingly you can treat. The issue with treating oral propranolol is acts very slow. It takes at least 1 or 2 months to start acting. So there is always some risk of amblyopia. In such cases, you can initially give a injectable triamcinolone, and once the major load of the tumor is gone, after that you can conservatively manage with the oral propranolol. This is the basic curve that you should know about capillary hemangioma of proliferation plateau and the involution phases of the tumor. Why you should know this is there? Because in the proliferation phase, you can treat either with the propranolol or the steroids, but in the plateau phase only steroids work, propranolol does not work. How will you understand that patient is in the proliferation phase or the plateau phase? It's by the history or the old photographs from the parents. Moving ahead, you know this is very easily diagnosed as a sebaceous gland carcinoma. Let it be a large or the small sebaceous gland carcinoma, the telltale signs of the tumor are same. And what are those? This loss of meibomian gland orifices, intrinsic vascularity of the tumor, lid margin thickening, and the loss of eyelashes. These are very important signs which differentiate any lesion or the meibomian cyst from the sebaceous gland carcinoma. And this is another variety of the sebaceous gland carcinoma. We call it as purgatoid, which does not come as a nodular swelling on the lid, but instead it occupies whole of the ocular surface. Now this is a general surgical principle, as a whole of the surgery cannot be covered. Basically, any lid tumor, any malignant lid tumor, the management, surgical management is same. We take the 4 millimeter clear margins of the tumor, because the excision biopsy is the treatment of choice. And then we make a lid coloboma, and the lid reconstruction is done. So 4 millimeter margin. Once you take the 4 millimeter margins, the frozen section is done on the table, and after that the lid reconstruction is done. If the frozen section is available in your institute, that's the best thing. If it is not available, you can still patch the patient, wait for the margin reports, let it take 1 or 2 days, and after that even reconstruction can be done. It's not necessary that you don't have a frozen section so you cannot operate a lid tumor. This is the coloboma created. This is just a small flow chart where we show that how the lower lid defects can be repaired. Generally, the defects created by these tumors are 50 to 75% or 75 to 90%. So in such a scenario, the huges and the cutler beard are the very useful procedures that help. Thank you.